What will I gain from this video? At the end of the video, you will be able to identify left upper lobe and left lower lobe collapse. To recap, the radiological signs of lobar collapse are direct, and this is shift of the fissures. The indirect signs of collapse include increased lung opacity, compensatory hyperinflation, hilar shift, mediastinal shift, elevated diaphragm, crowding of the ribs, crowding of pulmonary vessels, obscured borders. With left upper lobe collapse, the direction of collapse is superior, anterior, and medial. The major fissure will shift upwards and medially on the PA X-ray. On the lateral X-ray, we would expect the oblique fissure to be shifted anteriorly and superiorly. Here is an example of collapse of the left upper lobe. We see an increased opacity within the left lung as compared to the right. On the lateral X-ray, we see a distinct edge that should not be present, and this represents the oblique fissure and opacified lung anterior to it. The fissure is displaced anteriorly, and remember, this is the only hallmark or the only direct sign of volume loss within the lung. Here's another example of left upper lobe collapse. On the lateral X-ray, we again identify the opacity of the collapsed left upper lobe and the edge of the oblique fissure. In this case, however, we can identify a lucency superior to the opacity within the left lung. This represents the hyperinflated superior aspect of the left lower lobe that is now lying adjacent to the aortic arch. And this has been described as the Luftschild sign. What this represents is the crescent of hyperlucency that we see within the left apex with left upper lobe collapse. With left lower lobe collapse, the direction of collapse is inferior and medial on the PA examination. On the lateral X-ray, we would expect the oblique fissure to be shifted posteriorly and inferiorly. With left lower lobe collapse, we would expect to see an opacity in the retrocardiac region. As more and more of the air is lost within the lung, the opacity takes on a more triangular shape and becomes increasingly wider. To identify left lower lobe collapse on the PA film, we look for the triangular density behind the heart, and we confirm this on the lateral X-ray. This is an example of a triangular opacity in the retrocardiac region. We also see some lucencies within this region, and this is because this is a chronic collapse within the left lower lobe. This collapse has been there for probably over 20 years, and there are bronchiectatic and cystic changes that have developed within this collapse. So to recap, collapse can involve the left upper lobe or the left lower lobe. Look for displacement of the fissures. The lateral is important, and chronic collapse can be difficult to identify.